to the Boundless Body Podcast with Dr. Brian Tierney.
Welcome to the Boundless Body, Zahra Adloo.
Thank you for having me.
Yeah, just great to have you. So excited to have this discussion with you today.
Likewise.
Yeah. So just going to start with your bio and introduce our audience to you here. So Zahra Adloo is a clinical psychotherapist, a trauma and addiction specialist, a body dysmorphic disorder expert, a psychedelic integration coach, and an Ibogaine facilitator. So I want to introduce the audience because we've talked minimally about Ibogaine. So I'd like you to introduce that substance to the audience. But before that, maybe we could get a little bit more personal. Often where we start in the Boundless Body is the healer's initiation story, which often happens to be their suffering and their distress and their journey into the healing profession. And maybe that dovetails with Ibogaine for you.
Well, I'll definitely go into that story. But before I start, I want to preface that I only do integration and preparation work and therapy with clients who go through an Ibogaine treatment. To say that I'm a facilitator takes a long time to get to. So before the community bashes me, I want to make sure that I clarify that. But I work with a clinic in Mexico named New Path Ibogaine, who's doing amazing work. And before I got there, I actually have had 2 sessions on my own that came from me suffering mentally with anxiety, complex PTSD, being in a very toxic relationship, coming out of it for 11 years. And then also working in a treatment facility that, helped me realize how the treatment model for the addiction population is flawed and outdated and, is ineffective. One of the reasons why I bring that up is because we have, on average, since 2022, we have recorded 107,000 plus overdoses due to opiates and opioid addiction. And so, especially with fentanyl out there, people are not getting a second chance to go to treatment facilities over and over again and relapsing. So with me knowing that, I had to dig deeper to help myself, get out of this addicted relationship that I was in, this codependent relationship I was in, and then find a solution to be able to advocate for so that clients that I see have this therapeutic relationship with me and this trust that, can get them the outcome that they need. And that is to relieve themselves from the suffering of addictions in their life. I can go a little bit into why I went, but I'll let you ask any questions that you have for me.
Well, yeah. So sounds like this codependent relationship was one of the things that catapulted you into maybe graduate school, or was certainly a difficult era in your life. Narcissistic abuse is one of the things that you talk about a fair bit. I'm imagining that's one of the things that you were subject to in that relationship.
Right. In the relationship, I want to just go back to my childhood. I grew up with parents who immigrated to go to college here in the US from Iran. So I am Persian American. And they had to come and adjust to a whole new culture. And so for me, as the second generation immigrant child, I had to adjust to 2 worlds that did not accept me. And so my sense of autonomy and identity were really not strong as a child and even into early adulthood. So when I came across someone in my life in a romantic way who I felt was accepting of me in all aspects, I was a lot more vulnerable to it. And that was automatically intriguing for me. Somebody accepts me, given my background, given my culture, understands what I go through and is not judgmental towards me. And so I was automatically drawn to this person who, at that time I was 21, he was 22. And he didn't really know much about himself. Neither did I. So, he came in with a low sense of autonomy as well and was amazing for the majority of the relationship. And once he started to find who he was, or at least be able to present himself the way that he wanted to, given his achievements, I started to see the abuse come out more. So I'm someone who has body dysmorphic disorder. And one of the things that he would do he would ask me to get certain plastic surgery that I really didn't need. He would pick at things that he knew were bothering me because he would, obviously observe me obsessively looking at them. And that's one of the things with someone who has body dysmorphic disorder does. You obsessively look in the mirror because you're looking for this flaw, this perceived flaw, and you are constantly wanting to see if it's there or not. And so he would observe my behavior, and given, what he knew about me and my discomfort with my weight, when we would go out to eat, he would, tell me that I couldn't eat certain things. And, when I would address him about that, he wouldn't speak the next time, he wouldn't talk, but he would stare at me while I was eating to make it uncomfortable for me to eat. And so these are little things that I started to pick up on. And then, when I'd be around my friends, he would put me in, compromising situations where I felt like I needed to please both sides. So he would, make certain comments about my weight or the way I looked. And then I would freeze. My initial response would be to freeze because I didn't want to disrespect someone that I was with in that moment. But I also didn't want others my friends to see him in a negative light. So I was always in this anxious state in my body and my mind, not only from my own disorder, but from the constant reminder of the flaws that I had. I do this because it's, with someone who has this body dysmorphic disorder, it really is perceived. Nobody else can see it but you. And so when someone starts to pick at it, and this is someone that you've grown to trust, and, for 8 out of the 11 years was nothing but good to you, you actually start to believe, because you have this trust, you believe what they say. And put myself in a lot of situations where I didn't need to, I had surgery and I almost died from one of them, and it was unnecessary, to do that to myself. And I, only through self-love and doing the inner work did I realize that I needed to get out of this. And this was just one instance, but, mentally going through the suffering of someone putting me down on my, intellect or my achievements. But in retrospect, I had done far more than he had in his life. So, but I didn't see that then. When you're in the abuse and you're not separated from the person, you definitely trust, and you internalize everything, you personalize what you hear. It's not until you separate yourself and you start to pick up on the emotions that you receive, you get from the things that they say to you, that you start to want different for yourself. You start to realize that, this is abusive. And even with me knowing that and separating myself physically from this person, getting a restraining order, I was still emotionally attached. So I felt like I was stuck. And, a lot of people who have experienced trauma, they freeze and they feel like they're stuck in their traumatic state or in their circumstances. And so knowing that, and knowing about some of the research that's been done on dogs who have been shocked continuously in cages and then let go, they would still remain in their cage. This was a study done by Ivankov in Russia. I realized I was that person. I had all the resources, I had the support, I had the educational background, but I felt stuck. I felt like I needed this person in my life. And so that is when I chose to go on this Ibogaine journey. And I went and did my own treatment. And right away, right afterwards, I was completely done. I didn't need to contact this person anymore. I didn't need them to, give me the temporary relief of just them being in good standing with me. And this was all while I was going through a divorce. So imagine how crazy it sounds to go through a divorce with someone, but who's clearly abusive towards you, but then still need their reassurance and still need to be in contact with them and still somehow need them to be in your life because, they've been in your life for so long and you feel stuck and codependent. So whatever the plant medicine did was remarkable. It changed my life completely. And it made me realize like what my clients who suffered from addiction and from substances that changed their neurochemistry were going through. There is no comparison, but there is that one piece where you feel stuck and you feel bounded and you feel like, you are in distress when you don't have this person or this substance. And that is the feeling that I was able to understand.
The Boundless Body podcast is brought to you by Bi-Tapp, the creators of a powerful bilateral stimulation tool for nervous system regulation. I use this tapping technology clinically because it's a wonderful, gentle, pulsatile, tactile stimulation that helps the brain to regulate experience. And what I mean by regulate experience is not just managing the bad stuff, but amplifying the good stuff. So these tappers aren't just used clinically, they're used in many different settings, including with frontline workers, people that have test anxiety, kids and parents, teachers and school counselors, people in addiction recovery, restless sleepers, and people that are struggling with pain management and medical issues. So the benefits are vast. You can go to the Bi-Tapp website to get your tappers to help with your nervous system, and you can enter the Brian10 code to get your discount. I hope you enjoy the show.
And so it pushed me far more to go towards advocating for this plant medicine to help people understand how safe it can be under the right clinical care and team and how effective it is for relieving depressive symptoms, anxiety, traumatic PTSD, flashbacks, and that ultimate feeling of being stuck in your reality. Just wanting to reflect on this research study that was done on veterans alone, because Ibogaine is a Schedule I substance. Research is very limited in the US. But Stanford Medicine actually did this research with 30 veterans. 19 of them were suicidal and suffered from PTSD, traumatic brain injury, anxiety, and depression. And just 1 month after their treatment, their PTSD symptoms have declined 88%, 97% decline in their depression, and 81% decline in anxiety. And so that just kind of puts things into perspective as to how effective and how life-changing Ibogaine can be.
Yeah, one of my students did a presentation on this article. And Stanford, well done for orchestrating this Mexican treatment center and just avoiding the legalities of trying to do it in America and so on and so forth. They didn't have any affiliation with who you're working with down there, did they?
No. So this is Ambio Clinic that took in over 1,000 veterans recently, but I work with New Path Ibogaine. I still haven't gotten in contact with Ambio, but I'd love to work with them as well. New Path is actually working on their protocol for Parkinson's disease. So this has been very effective treatment for people who suffer from Parkinson's. And the protocol was actually discovered and finalized in Zurich, Switzerland. So they're now finalizing it at New Path for neurodegenerative diseases. So not just Parkinson's, but MS and a few others that I'm aware of.
Yeah, I have a friend that's actually microdosing Ibogaine, taking the Ibogaine via microdose.
Yeah, that's actually been really effective too. So in Spain, they did a study. This was ICEERS. It's an institute in Europe. They did a study in Spain with people who were addicted to methadone or wanted to come off of methadone. And for those who don't know what that is, it's a longer active. And so what they did is they gave them small microdosages of Ibogaine and eventually weaned them off of the methadone, which is really, really hard to get off of. Really, really difficult. But with the microdosing, it helped. So they had 2 control groups, each consisting of 10 participants. For the first control group, they gave them 100 milligrams. And then for the second, they kept increasing it up to 600. And the second group, they had tremendous outcomes. They were all without the need of methadone. And just, even a month afterwards, they were surveyed and still no cravings for methadone, which is incredible.
Incredible. So is there any sense for what the mechanism of action is, or the pharmacodynamics, like what's happening? Like the neuroscience nerd in me wants to know if you know any data about like what's happening in the brain, what neurotransmitters are being tagged, are there peptides? Have you done any research along those lines in terms of mechanism of action?
Yeah, I do know about the target of the kappa opioid receptors and BDNF and GDNF. And so that in itself, like the kappa opioid receptors, as you know, like that's responsible for those anxious feelings and depression if it's overactive. And so what this does is it completely rewires or like resets it to get you to a pre-addictive state. And so that's what's been really effective. I'm not a neuroscientist, but based on Kenneth Alper, he did a really good research article, or he did research in general on the pharmacodynamics of Ibogaine on the brain and the effects of it.
Yeah, so the BDNF, brain-derived neurotrophic factor, this is an important one because it's the trophic system, meaning it stimulates new growth. And that, ketamine does this as well. It plugs into the BDNF system to stimulate new neural offshoots and so on. And that's important, right? If you want to think differently, if you want to perceive differently, if you want to come out of your habits of perception, you kind of need new neural networks and new neural connections and so on. So I think it's good to have that BDNF connection. Kappa opioid thing, that's great. Kind of like this idea of resetting the opioid system and the opioid processing habits.
So, I mean, like BDNF, right? What you were talking about is like neuroplasticity, essentially, right? And so with that said, other psychedelics usually give you like a critical period of 2 weeks at the most. I know ayahuasca does that, and so does psilocybin. But with Ibogaine, they've shown that critical period is 1 month. And this is why it's so important to do integration work, because you have 1 month where your brain is firing differently and you can pick up on new habits and really change your lifestyle so that you're not going back to the same things that led you to your addictive habits, or this, the very things that gave you the temporary relief that they did. And no judgment to any of that, right? Because those are parts of us that wanted to help us, and, in whatever way that they knew how to, they just aren't effective long term. So there's always, there are new ways of wanting to heal yourself and to deal with anxiety or life stressors. And so that's why it's so important to work with someone to help you not only hold yourself accountable, but help you identify what life means after this Ibogaine journey. Because you can just do it and you're out in the open and so receptive and so vulnerable and very, very sensitive after the treatment. So you really need your environment to be safe. You need the people in your life to be healthy and safe and accepting of you, and your lifestyle and the choices, the hobbies, the things that you want to do to be effective for you, and not maladaptive like the others.
Because if you want to change your maps, if you want to reassemble your model of reality, you kind of need a major stimulus, right? Like for you, in your case, you had internalized this oppressor. You had this map of your body that was out of whack. And that pattern was, neurologically speaking, deeply ingrained. So like having that whole month to rewire your brain was a good thing, obviously, because now you're helping people with body dysmorphia, right? So can you maybe tell us a little bit about the subjective experience? What made you decide to fly to Mexico? I'm assuming it was Mexico that you originally went to.
So I am a part of this Native American church, or I was. And so there was a chief that spoke to me about Ibogaine, and she basically, said, I think you should do this. And the reason why I actually ran with what she suggested, was because I saw this documentary in graduate school titled Dose that's been resurfacing on the internet. But it spoke about this woman who had a 17-year plus heroin addiction, who went and did an Ibogaine journey and was eventually free of her addiction. But it always stood out to me in my mind because here I am in graduate school. I went in the path to specialize in addiction, which in my life, I had never been around anyone addicted, or, I lived in a house that didn't even drink or do any type of drug. So it was all unfamiliar, but I wanted to challenge myself and be around a population that I was unfamiliar with. And so I already had that in my mind in graduate school. I graduated, had to earn my hours, and worked again in the addiction space. And so seeing the treatment model be so ineffective, and then having that in the back of my mind was like, there's a reason why this keeps coming up in my life there. And like Ibogaine keeps getting, put back into my psyche and my thoughts. I need to go do this. I need to go figure this out before I can advocate for anything, or, I like to experiment with it. I like to go and try it out or learn more about it. And I was like, well, right now I don't feel an alignment in my life. Right now I'm suffering. Let me see if there's something that this plant medicine can do for me. And right away, you come out with this drive, this purpose, this like eagerness to want to tackle life. It's a feeling I can't describe beyond what I just mentioned. It's so empowering to where I was like, I need to figure out more. I need to go learn this. And I went out to Mexico to another treatment center, and I like observed them and their practices. I learned a lot, particularly from this woman named Asha, a gentleman named Rocky, who are really big in this space. They've been doing this work for 20 plus years. And again, just kept going towards it because I kept seeing miracles happen in front of me. I mean, someone with Lyme disease went down for treatment and completely healed from their Lyme disease. So there's so much to unfold and to discover. I started my journey in 2023. And so we're just in the beginning of 2025. And I've learned so much throughout this period of time. It continues to blow my mind. I went specifically for just the curiosity, my own suffering, and the need to want to expand upon my work and to be able to actually offer clients something that works, that does not give them this temporary solution. And what I mean by temporary is that when you have people who are coming to a center for addiction, they're in a structured setting. They're given their schedule from the moment they wake up to the moment they go to sleep. Once they leave that setting, that's when they go back to, relapsing. And so what can I do to help people who need the neurochemical change? They need the rewiring because their brain has been so damaged. And so this was it. It's like, well, reading the research, seeing it in front of my eyes, now like being affiliated to a clinic that I work with who's constantly sending me clients, and I'm understanding their background and seeing their glow and their optimism about life afterwards pushes me more to continue to do this work.
Do you think it's true that Ibogaine has the longest half-life of any psychedelic out there?
So far, that's what they are saying. That's what the research has shown. I don't know. I mean, they say that this is the strongest psychedelic, and then, yes, the half-life is strong and longer. So far, there hasn't been any other psychedelic out there that proves differently. I will also say that Ibogaine is considered an entheogen. So it puts people in this like wake-like dream state. And like going back to your question, my experience, I'd love to like actually explain what that is when you're in that setting. When you're under treatment, what happens is usually everything that you dream about is now like in front of you. Your life starts to unfold like a projector in front of you. So you don't sleep for those like 72 hours, but you're not tired. And the whole time your thoughts and your unprocessed conscious beliefs and everything that needs to be processed just comes in one after the other. So it can be anxiety provoking when you're in the journey because you're like, whoa, I didn't think about this, or I didn't know this. It just all comes up so you can process it and then let it go. And then one thing that's really special about Ibogaine, and when you're in your treatment, you are so grounded. It's not like ayahuasca. It's not like the other psychedelics where they tell you set an intention, but you don't know where you'll go. With Ibogaine, most of the time you are going to have visions of your family members or your roots and your ancestors come up. And it's really interesting because it's derived from a root bark from a tree, but then it's taking you to your roots. So it's really cool because you feel like you're connected to its consciousness. And so I, in both my journeys, saw family members. I saw myself from inception to, where I am right now and how I was raised by my parents and what they had to go through. It helped me understand my father's psyche a lot more, and my mother, my grandparents. It really helped me understand their journey so that I did not have this aggressiveness or aggression towards them for not understanding mine as a second generation immigrant. It helped me become closer to my family. And most people say that that is what happens for them. They see their ancestors, their family. Sometimes they even see animals that give them certain messages, which is similar to what people experience with ayahuasca. But again, if someone was to walk into the room, I could completely have a conversation with them. The thing is with Ibogaine, though, you don't want people to be in the room with you. You want to be left alone. It is a complete journey within. You're not taking out of your environment. You're not on another planet or in another realm. You are completely there with you and your thoughts, and you just want to be your own therapist. And so anyone who comes in a room to just check up on you is great, but you're like, okay, when are they going to leave? Because you want to do this journey for it's that empowering. It's that deep within to where you want to go towards it and understand it more. There's not a scary moment in it. I will say in the beginning, you might purge, which they say is really good because you're eliminating what is in the gut and what, the emotions that you have.
That means puking, right?
Right. Yes. Puking. So a lot of puking, you just experience something called ataxia. So like your body is a lot weaker. And so for certain moments when you need to go to the bathroom, you might want help with someone taking you there. But you experience that for maybe like a few hours. And then after that, at least for me, I was completely fine. The racing thoughts were really uncomfortable for me. And so that's something that I want to highlight. Again, like they were all necessary. So my journey, if I wanted to choose between ayahuasca and Ibogaine, despite the fact that the journey's longer, I would 100% pick Ibogaine because I have like a type A personality and I like to be grounded. And so when I was in my ayahuasca journey, not knowing where I was and feeling so disoriented was just not settling for me. It was a great journey in itself, but not something that worked for me. And I think that's really important for people to tune in to what feels good for them. You're wise and you're the person who could choose your own journey. So for me, this was my experience.
That's interesting, right? Because Ibogaine actually comes from a root, and then whereas ayahuasca comes from like growing vines, right?
Yeah.
And that's an interesting way to think about it. It reminds me of some of my old days with traditional Chinese medicine, where you would, if you wanted to be more grounded, you would eat more roots, more root vegetables. If you wanted to have more energy and vitality, you would eat more kind of climbing greens and things that are like expansive like that.
Mm-hmm.
It's quite interesting.
Very, very.
So were you taken also beyond your parents to kind of your deep Persian lineage as well? Did it kind of go deep into the ancestral space, or did it stay quite personal with your family and your parents?
It did stay personal with my parents. I saw glimpses of my grandmother who's deceased. The deep message and the work was with my parents because I had this discord with them. And that's what it helped me heal. It helped me not see them from my perspective, but be able to see them through theirs. And once I had that understanding, I was able to be way more empathetic with them. My father grew up in a generation where they didn't talk about their feelings. It was so unfamiliar for him to disclose what an emotion was for him or how something made him feel. And so it was really hard for me to connect because I'm someone who always talks about my feelings and always goes deep into that because I'm a highly sensitive person. I'm not just saying that. I've had a brain scan show me that. it was really hard for me to connect with him. And I was really appreciative of the plant medicine because at the moment I was out of my journey, the first thing I wanted to do was call my dad and just talk to him and cry with him on the phone, because I also would hold back my feelings when talking to him because I felt his discomfort with how uncomfortable it was for him to talk about his feelings. But when I was on the phone with him, he heard me cry for the first time in probably like 12 plus years. So through my vulnerability, he was able to be, vulnerable. And I think that was a remarkable experience.
Vulnerability fucking rocks, doesn't it? Just
it does.
Vulnerability. Fuck yeah. Here's a shout out to vulnerability. Yes.
Like,
so many of us, right, can get stuck in a trance, and it's like this allergy against vulnerability. But the irony and the paradox is vulnerability. That is the vector towards healing. That is the vector towards relationship. If we have a couple choices when we're in a conflict in a relationship to kind of like kvetch and moan and complain versus like talk about impact, talk about, the ouchie, talk about the vulnerability, that's the glue of connection right there. That's the glue of relatedness.
Absolutely.
Simple, but not easy.
No, not at all. And, I follow this neuroscientist, Tara Swart. I listen to her. I love neuroscience. I wish I would have went into it, and I probably will in the future. But I listen to her podcast, and she speaks about vulnerability as well, and how important it is to journal your thoughts or to vent to someone or to have a therapist. Because when you keep those thoughts in your mind or within, you're actually releasing cortisol, which is stressing your body out more. So it's so important to verbalize what you're going through, to surpass that fear of maybe being perceived a certain way if if you're vulnerable, or people judging you, whatever it is. It's so important for your own health from a mental and a physical standpoint to just get it out. Get it out so that, it's no longer affecting you in the way that it has, and it's not circulating up here.
Yeah. Hard to do that when you're in relationship with somebody who's, I'd prefer to say, narcissistically possessed or possessed by the royal archetype. But, in common discourse, it's the narcissist. Hard to do that, though, when you're with somebody that literally can't listen to you because they're the center of the universe. Yeah.
It's interesting because when you're in the relationship, you don't want to see that person in that light. It wasn't until we did a couples therapy that there was a moment where the couples therapist, she had a moment where she only had me in the room before he joined. And she's like, do you see, she asks me, she's like, how's the relationship going? And I'm telling her, it's not well. I don't want to be in this. And as soon as he joins, she asks him the same question. He's like, oh, it's going great. We're doing fantastic. And she looks at me. And right after the conversation or the session, she goes, he has a completely different perspective, and it's all his. It's all his. He's not listening to you. He doesn't see you. He doesn't understand. He doesn't have that capacity. And it's interesting because for most of the relationship, he presented himself as highly empathetic and emotional, but it was something that he had to learn to do to be able to have a connection with someone, because so many people dismissed him. It was a learned behavior that worked for him to build connection, but it wasn't him. He didn't have the capacity to understand. So sometimes, I say this, when you're feeling like something's off, you don't know what it is. And even with the clear signs, you're blind to it because you're deep in something. Try to involve like your close family members, your friends, people that you really, really trust, to be around you and your partner more often than not, because they will be able to pick up on things. And eventually, when you hear them give you feedback, you can't not trust all of them. That's what helped me a lot when I say support is so important to have. And the narcissist will often try to isolate you from that. They'll try to have you all for themselves. Like with him, he would try to do everything for me so that I didn't need others, including myself. I didn't, You don't need yourself to do anything. I can do it all for you. And that's disempowering, but also isolates you from people who can see objectively what's going on and to give you those warnings. So I would say in any relationship that you're in, never disconnect yourself from your family, if they're healthy for you, and the friends, the close friends that you have that truly love you and have known you longer.
Yeah, because he just latched on to your weakness like a leech or a vampire. You're kind of chink in your armor, your vulnerability around your self-image. He just latched.
Yeah.
And just started sucking the life out of you.
Mm-hmm. Yeah, would point out things that were just not there. I'd be like super happy about me working out, doing all the things that I needed to do to be physically healthy. And even when he would see me happy like that, that's when I would notice him picking more. And I was like, what is this? I automatically felt something off within. I just didn't want to trust it. What I've noticed for myself, they pull you away from that inner gut feeling that you have, that intuition. They make you think that what you are feeling and what you think is not good enough, and that you can't trust it. That you can't trust it, and that you can only trust what they tell you because they know what's best for you. That was not only disempowering, but I just did not feel aligned to myself. I was always anxious. Those are my symptoms. It took for me to physically separate myself after months and do my Ibogaine treatment to be able to completely see, eyes wide open. So it's tough when you're in it. I'm a therapist. I studied this. It's like you have this shame because you're like, I should know better. But when you're in it, you can be a neurosurgeon or, an Elon Musk, whatever. You can be someone with such high achievements in your life and still be blinded to it.
Elon Musk.
I don't know. Maybe that was
I mean, I haven't talked about him on the podcast yet, and I don't want to today. So we'll just table Elon for now. Hey there, buddy. And I'm hoping that we can talk a little bit about the tradition. Ibogaine, the traditional use of Ibogaine. So I've read, I know a bit about Ibogaine. I know a bit about some of the risks. I know a little bit about the pharmacology of it from that Stanford paper. And I read Breaking Open the Head by Daniel Pinchbeck, which is really interesting about the tradition. He was an anthropologist, and, he lived with the Bi-Tapp people, which is one of the tribes that traditionally uses Ibogaine. Yeah, the Bi-Tapp.
Yes. Yeah.
Can you talk a little bit about the traditional use of it?
Yeah, absolutely. So the Bi-Tapp tribe in Gabon, Africa, actually has been practicing this for 300 plus years. They have ceremonies and rituals almost like on a regular basis where they include not just their elders, but even babies. So they'll dose babies with small amounts as a way to initiate them into the tradition. But what they use is Iboga. So Ibogaine is one of the alkaloids that exists within the Iboga plant, but Iboga consists of 13 different alkaloids. So what they're using is a lot stronger. And so they have dances, they have rituals. They really see this as a religious sacrament. And this was something that they've used before they had any like French invasions, insisting that they practice Christianity. So now what they do is they actually intermixed Christianity and their own cultural teachings and practice for both. Like they intermixed both of them. They have like ceremonies where they happen all throughout the night. And so they go out into the woods and they have different parts where they paint you with different paints that represent something. I will say that for the most part, they don't use this to help people fight addictions. It is just a part of their lifestyle. And if there's an addiction involved, then yes, it helps with that. The part that's been used for addiction and for the opioid crisis was westernized about 50 plus years ago by accident by Howard Lotsof. So what we know it as in the Western world is not what it is over there. And I can't speak much more than what I shared because I haven't been there and I haven't witnessed it. But there's a book actually called Iboga. It has a yellow cover, and it's the only one that is titled that goes into the deep traditions of the tribes and what they mean, and how you can become initiated to become a master of facilitating this plant medicine. But there are steps to it. There are years of experience that are needed. And usually these people grow into this cultural practice. And so, to call themselves a facilitator, you're talking to people that have been doing this since they were children and who've witnessed the practices since they were children. So that's why in the beginning of our podcast, I wanted to preface that I am not, and I do not hold that title because I've only been introduced to this plant medicine since 2019. And so it's just, it doesn't pay reverence to the people who have had this be a part of their lifestyle since they were infants.
And it's not the picture of kind of like randomized control trial where there's something up with magnesium that can be very dangerous. Am I correct about that?
So for veterans who are going for traumatic brain injury, they have been using magnesium alongside ibogaine.
Oh, magnesium is the support.
Yes, it's the support.
Okay, it must be potassium or some other thing that is the danger because the heart could stop.
Right. So magnesium supports because what ibogaine does is it targets the heart, right? So it lowers the heart rate. And so for people who have arrhythmias or past issues with their heart or their cardiovascular system, it's a risk. That's why you have to do tests. And I'm glad that you brought this up because this addresses the safety component. But you have to get like a liver panel test to check your liver enzymes. You have to get an EKG to make sure that your heart can handle ibogaine. But for people who have been doing the journey with ibogaine for their traumatic brain injury, they have seen that magnesium is a great support for alleviating some of the stressors that it has on the heart and the cardiovascular system.
You said before that you were a member of a Native American church. Is that the Lakota Sioux?
No. The reason why I even said I was because it's been so long that I don't even remember the name of the tribe. So that's why I mentioned, but ONAC, that's what it is. ONAC is based out of Utah. I became a member because I wanted to be able to have the legal right of carrying a certain amount of psilocybin or San Pedro or whatever plant medicine that I wanted to work with on me without being incriminated. And a lot of people are using that route. When it came to facilitating ibogaine or learning about ibogaine, I remember getting in touch with the chief, and she's the one that actually does the facilitations. And she told me that ibogaine is not something that I could possibly hold and have the legal shield for. So I reached out to another Native American tribe that I'm working with right now, and they actually have met with me, and I've talked to them a lot, and I'm taking these rigorous courses from them to help them vet me out to eventually be able to legally have the shield from them to use this as a religious sacrament to be able to help people facilitate in the future. And I plan on taking that to Puerto Rico, obviously with a whole clinical team that I've connected with down there eventually. So that is why I said I was affiliated, because I felt more affiliated with this new tribe because they actually took the time to get to know me and understand what it is that I wanted to do and give me the pathway to be able to get there.
Would you feel comfortable sharing the name of the new tribe?
So it's called NIAC, NAIC, Native American Indigenous Church.
So it's a more general kind of body of, it's kind of like a unified space for, it's intertribal.
They actually are the ones that helped the Sentadaimi, and there's another religious group for ayahuasca get their legal shield to be able to practice in Washington state. They have a huge legal team. They vet people out. So if you're going in as an investor, like someone who clearly just wants to use the plant medicines for monetary gains, they're going to be able to recognize that within you. I gave James is the chief there, James Johnson. And I spoke to him on the phone and had no idea who he was. And I was like, you know what, James, this is what I want to do. This is my background. Can you help me? And he knew all about Ibogaine. He knows so much about everything. He has a lot of people who go to him to be able to practice their religious sacraments in the US. And he also makes sure to ask you the questions. They want to get to know you. They want you to take certain courses with them. And then they have a powwow for you to determine whether you are going to be initiated in their tribe and whether they're going to give you the legal shield. So I think it's really important to be able to become a part of something or someone that actually gets the time to get to know you. The other tribe, I didn't get that feeling from them. I didn't get that action from them. So this one resonated with my personality more.
Well, I resonate with the process, that there's a vetting, that there's a deep concern for like who's initiated and who gets the shield and like who's in.
Right.
So I'd love to talk with James on the podcast, to connect with him about.
Wise. Oh my goodness. I will 100% love to connect you to have him share his wisdom and all that he knows about not just Ibogaine, but all the Native American plants and herbs and all the practices from all over the world that he's been able to help legalize here for people to practice.
Like it or not, we're in a new age, AI is here and we do not know where we're going, and like psychedelics now in its kind of westernized component is kind of like you have this holy grail myth coming in where the big corporations are trying to get their trademarks on the molecules and stuff like that. But not only that, there's a lot of shadow stuff happening in the psychedelic community. I don't know if you've listened to Cover Story. Have you listened to Cover Story?
No, but I want to ask you about that, but I also want to talk about the underground of Ibogaine treatment too, of, the safety and the concerns that people need to have before they seek out a treatment at a center, because it's an unregulated market. So when you talk about shadow, that's what comes up for me. There are a lot of people that are out there doing this treatment for monetary gains and really are not concerned with the well-being of the individuals that come down there, which then re-traumatizes people. This is a huge topic to discuss, but I want you to go into what you were talking about.
Well, yeah, it's, the shadow behind the scenes, beneath the scenes too, I suppose. And this shadow, and I think this is a human thing to want to have some savior that's just going to take away the suffering. And, like I hear things like this psychedelic or that psychedelic is the substitute for 6 years of therapy. On one level, it's like, yeah, there can be these breakthrough moments, but in my imagination, it's not a substitute for the long work required to like be a generous, kind, loving human.
Mm-hmm.
That takes work, and it takes a concerted effort to look at your shadow and not project it onto other people. And that's where, psychology and spirituality come together. When spiritual approaches are capitalized and in a monetary system, tend to overlook ethics and overlook the psychological dimensions of what we call shadow work, right? The stuff that we hide, repress, and deny, and then project onto other people to have them be kind of functional garbage bins for the stuff that we don't want to admit to maintain our innocence. You know what I mean? That happens a lot. Just kind of like guru dynamics, but just now in the psychedelic community.
Yeah.
The shadow guru dynamics. I'm not talking about,
Yeah. Oh, yeah.
Which is narcissism, really. I mean, if it comes back to narcissism, I suppose.
Believe it or not, a lot of shamans out there are complete narcissists. And they really are, and they re-traumatize people. And it's so dangerous to be a part of being under that conscious state and then having someone project their stuff onto you because they're unable to see themselves. Narcissism someone who has that is unaware of who they are and what it is that they need to work on. They just are unable to see that. And so here you're working with someone who claims that they have this grandiose sense of self. They have this like power and connection to this plant medicine, but are projecting onto you while you're in your vulnerable state. So I think it's so important that when you deal with a healer, you ask them how much work they've done on themselves, because we're always doing work on ourselves. We're always looking at who we are and finding ways to navigate our shadow selves or understand, why we are the way that we are. And so you want to really get the deep history of whoever you're working with before you go on these journeys. I mean, there are a lot of retreat centers in Peru or, other countries who are opening people up to ayahuasca, but some of them don't even speak the language that the person's going with. And there are a lot of shamans that are sexually abusing women. And so you have to be very mindful of where you go, who you're dealing with. Don't look at this as a trend. Look at this as a huge journey in life that you have to take, that you have to continuously work on, even afterwards. Otherwise, Ibogaine in particular, you're wasting thousands of dollars because it's one of the most expensive treatments to get. You're looking at putting out a lot of money. But if you want to invest in yourself in that way, you have to continuously invest in the after work.
Yeah, thank you for highlighting the empowerment, because I think, because shamanism, classical shamanism, there is an initiatory hierarchy in ways that are akin to other hierarchies. They have a kinship with other hierarchies. So you have a power grid in society, and the shaman holds power. And, is every human perfectly ethical and responsible with their power, whether they're a traditional culture or a non-traditional culture? No, we have our failings and our flaws. And I think, when somebody's higher up on the hierarchy, for example, when we're in the West, if we're consulting a medical doctor and they have that white coat and the stethoscope and we're in that environment, we can clamp up and get glamored by their presence and their power and their hierarchical position. And it's hard to ask questions of the doctor when we're glamored by that power. It's hard to kind of, empower ourselves and be like, wait, I have a question for you.
Right.
Because we're like under a trance or something of the power.
Yeah. Humility goes a long way with any position you hold, right? You want people to feel at ease when they approach you. So, just how we have a treatment team, I feel like in the shamanic space or in the spiritual space, there needs to be a team and not just one person holding all of that power. We all need to collaborate. We all need to discuss what it is that we want to discuss for the well-being of this client or this patient. Like you said, a lot of people can misuse that power. And in a lot of cases, the person who is behind that, or getting treated by that person feels intimidated or unwilling to open up because they're so anxious and timid, given, the power they feel from the other person or that projection.
So ask questions. Do they have a sense of humor? That would be an internal question. You know what I mean? Does this person have a sense of humor? Do they have humility? Humility and humor are often related. What are some questions a person might ask of a leader just to get a sense for, what do you think? Any ideas?
Well, how long have you been doing this work for? Or do you have a clinical team? Do you do tests? Do you do medical tests to determine whether I'm physically able to go under this treatment? Have you connected to the roots of where this practice came from? You want to always respect the roots of it. You want to also ask about their own personal journey and what they went through, right? That gives you a huge picture. For the person that treated me, her husband was actually an addict. And so her relationship to him and what she's witnessed with him was the reason she wanted to start to facilitate Ibogaine. The other clinic I went to, he was an addict and they were both addicts. And so they've experienced suffering from so many different angles in their life. And they went on this journey to find healing within and to have better lives for themselves. And so I think it's really important to understand the background of the person, because for me, Like I would want to know that they either have studied this and have had years of experience, or that they've learned through it from their own personal experience of having to find solace and peace. You would never ask a plumber for hair advice. So I would want to know whether this person has the expertise and the background to be able to sit with this medicine and work with me when I'm in my journey without projecting their own stuff onto me because they haven't done the inner work.
Yeah, well said. So addiction, it's not just the opioids that it's just kind of general addiction treatment that Ibogaine is good for. So it could be an alcoholic or other substance that a person is addicted to.
The only substance that it doesn't really have a lot of effect for are substances, as classes, are benzodiazepines. So benzos are really, really difficult to come off of, and you actually have to titrate yourself up with the right medical assistance. But that is the only one. So that, when it comes to porn addiction and gambling, so not just substances, but behavioral addictions. From when I was 14 years old, every time I had to buy something every day, whether it was a piece of gum, clothing, something, I had to buy something every day. And after my treatment, I don't have that need. Like it was basically, I would get anxious and I had to relieve myself from getting something that would give me that dopamine rush, and completely gone. Like I now think about the things that I need and purchase wisely, and instead have been able to save so much so that I can donate and be of service to other people instead of just hoarding and having so much for myself because I was just so dysregulated within. Mm-hmm. So behavioral addictions are also on that list, not just substances.
So is it generally a one-off treatment? It's framed as you do this once. It's a 72-hour, just like big experience that takes presumably years to integrate.
Yeah. So really, you do a one-off treatment. And then after some months, your facilitator, the person who gave you the medicine, the flood dose, might give you booster doses just to kind of keep you connected to the Ibogaine that gets released in your body after you ingest the Ibogaine. So sometimes you get boosters, which are like microdoses of Ibogaine. But in most cases, especially people who are doing this for the psychotherapeutic purposes, like what with me, because I had no addictions to substances in particular, the one-off was just right. So you really don't, it's not a journey you go on often.
Yeah. Well, you also mentioned that it's being used now for traumatic brain injuries. That's really cool because TBI, I heard the statistic recently that 80% of incarcerated individuals in America have a traumatic brain injury, which makes sense, right? Because you get these microglial tears in the brain and it throws off the whole core metabolism of the brain, and we're in inflammation, deep inflammation. If we're in deep inflammation, then it's going to be hard to grow new neurons. If it's hard to grow new neurons, it's going to be hard to self-regulate or learn how to self-regulate, right? So that's really cool that it could be used for traumatic brain injury.
And like it also obviously helps with the impulsivity too. So you're able to make wiser decisions after your treatment. And so I learned more about it through the veteran standpoint. I didn't know about people who were suffering with TBI in prison. But overall, like for people who were in this study, I think 87% is a huge number. It's a huge number to be relieved of, whatever issues that you had to function on a day-to-day basis, given the explosions you've experienced or the head injuries that you've had to go through while you were in combat. So I think that it's really remarkable that you mentioned that they also found evidence of it being effective for people in prison. I think it helps a lot of people who are not looked upon, are kind of dismissed in society. So you have people who are veterans who are highly suicidal, who are finding it difficult to adjust to society again and be a part of civilian life or have a lifestyle within amongst others who haven't experienced what they've experienced. You also have these people who are imprisoned and who probably grew up in systemic trauma or environments that cause them to pick up on these behaviors for survival and have went through a lot of trauma. I'm witnessing deaths or gang violence. And so therefore their neurochemistry is completely different, right? Their amygdala is larger, right? Their
frontal cortex,
right? That shrinkage or that size being at the size that it is, like you're not able to think about the decisions that you make. You're way more impulsive because you're in survival mode, right? So I think it's great that you address that, because here it is, a population that again is not, addressed and noticed. And there's a lot of judgment that goes behind the people that are behind bars without knowing their story. Yeah.
I mean, you have intergenerational trauma, you have cortisol sensitization, which is a biggie. It's in the epigenetics research. So through intergenerational trauma, you have just being in the womb of a stressed out mother who's subject to systemic oppression, through epigenetic switches on and off regions of the brain and, cellular processes, endocrine processes, such that the body is desensitized to cortisol. Cortisol is good until it's not.
Right.
Cortisol is an anti-inflammatory. So if the body is oversensitized to it, desensitized to it, then cortisol isn't going to do its job of being an anti-inflammatory. So then what happens? The brain gets inflamed. If the brain is inflamed from a really young age, right? Those hookups from the prefrontal down to the basement area, the amygdala and the periaqueductal gray and so on, those hookups aren't going to happen. We're going to have too much impulsivity. We're going to have acting out. We're going to have conduct disorders. And then obviously an increased likelihood of, becoming dysregulated. And what does that mean? Often getting a head injury. Then what happens with the head injury? The head injury happens, and then we have microglial tears in the glial system of the brain. More inflammation. More inflammation means more difficult to regulate. More likelihood that the person is going to turn towards drugs and addiction, being on the street, getting into violent acts, and so on. It's a social problem. It's not just the individual moral problem of a person.
You weren't born that way, right? And epigenetics might have influenced you to make certain decisions or to be a certain way, right? But you're not born a criminal. It's based on your environment, your upbringing, what you went through, the trauma you've experienced that help, have you making the decisions that you make. And you're obviously your neurochemistry.
Yeah.
I'm really glad that you explained that. Thank you.
So I'm wondering if we can shift gears and talk a little bit about how Ibogaine has influenced your life philosophy. You mentioned yoga philosophy, that this is something that you'd like to talk about. This is something that you've been immersed in. We also talked about both of us having a love for many different spiritualities and a sort of interdisciplinary approach to spirituality and religion. And I'm wondering how Ibogaine has fit into your spiritual cosmology and your kind of interdisciplinary religious connections, and how yoga philosophy slots into that.
I really admire yoga, because before I went to actually learn about yoga philosophy and what yoga meant, I had it limited to just the asanas, which is what we practice, where we know it most in the Western world. Go to a yoga studio and do the movements. When I went to Rishikesh, I realized that there's a whole lifestyle that comes along with being a yogi. And there are 8 limbs of yoga that actualize you to become the yogi that you aspire to be. I always reflect back on self-study. That is one of the yoga philosophy terms that really resonated with me. It's through yourself that you're able to learn what your purpose is, and through your own experiences. And for me, I grew up in a religious Muslim household, but I always felt like intrigued by other people and their cultures and their way of living. And when I went to this yoga school, I was surrounded by people from all different walks of life. And we were all practicing this ancient practice and getting along and connecting. And And that is the unity that I always looked for. I hate the separation based on religious factors or racial factors or socioeconomic status, right? But on this mat, in this group, yes, you're working on yourself. Even from talking about the asanas, you're doing the moves on your own, but you're part of this collective group. So it just puts things into perspective. Like you are this microcosm that exists within this macrocosm. So while you work on yourself, you're radiating outwards and helping others around you who need your help. And so yoga philosophy helps me realize how connected we all are, no matter where we're from, and how all the practices that we do is really just to enrich our own lives, but also contribute to the greater society and help others feel connected and united as well through our own work. And I love that piece that I take from yoga. I love that it's not just individualistic. We are a collective, but it's also important to focus within and do your individual work. So, just to put things into perspective, I have this yoga philosophy deck. It's called the yogic deck. And Sahara Rose is the one. And so you can really it's an oracle deck, and you can pull a card from it every day and learn about a yoga philosophy term that you can apply in your life, or that you can, teach your group as you're leading a yogic session. That is what I use. I feel connected to incorporate in my life, because no matter where you're from in the world, no matter what you practice or what you grew up practicing, all those terms can apply to you and help you enrich your own awareness and your own service to this world.
Nice. Well, I'm thinking actually, because all of us are out of Africa.
Yeah.
You know what I mean? All of us that's genetically proven through mitochondrial DNA. It's just like we all come from Africa. So therefore, Africa's our roots. Mm-hmm. So I'm thinking, well, why not? Why couldn't the roots of the yoga tree with its limbs be Africa? Because where else could it come from? So I'm just kind of pitching you a slow pitch softball to bring in Ibogaine to, connect with
the trees are symbolic if you think about it, right?
Yeah.
Like the 8 limbs of yoga, and then the iboga plant and the roots of it all. It's incredible how, and then not just that, just speaking about trees itself, like they release phytonicides. I don't know if you know about that, but that help you feel relief and eliminates your stress and anxiety to a certain degree. So like when people actually hug a tree or they're in the presence of a tree, not only is it symbolic in Ibogaine treatment and yoga philosophy, but it actually does do something for you externally as well.
Yeah, I mean, so the tree hugger thing gets so much derision, and it's like, fuck that. Just go hug a tree and you're an expression of nature. Get over it.
There's a reason why most psychedelic journeys are in nature, and there's always a tree. And, most people who have had deep psychedelic journeys will always talk about how they connected to a tree. So there's just something there, right? There's this wisdom.
Yeah, like hanging on for dear life, right? Help me find my ground. You were into other psychedelics before Ibogaine.
I got certified in psilocybin treatment, so magic mushrooms. I got certified in the state of Oregon. And I started my first journey with ayahuasca, and that was just a little bit after I finished my yoga teacher training in 2017. I had a friend who mentioned ayahuasca a few times. She was from Sweden at my yoga school. And then I connected with this Persian woman in New Jersey whose husband was a shaman at the time, who studied in the jungles of Brazil. And she mentioned ayahuasca. And I said, well, there's a reason why I'm, being called to this. I wasn't happy in my life at the time with my career. And so I was like, let me go and try this out. So I'm not someone who drinks. I don't smoke. I don't do any drugs. And here I am doing my first journey of psychedelics with ayahuasca, which a lot of people will laugh about. And they're like, whoa, you went straight in. And that was really, really transformative. I didn't do another journey until 3 years after that because I was still processing the first one. And at this point, I didn't have my clinical knowledge and counseling. I was just figuring it out. So I'm wondering why the other journeys afterwards were so deep and transformative for me. I think it had to do with me having this clinical background and this education that I had afterwards. My progress was a lot shorter than my first journey. So I moved on to magic mushrooms right at the height of the pandemic. It was the first time I took one, and I had just clear insights into my emotions and how much I was holding in my body. I found it really difficult to connect. I always got along with people, but I wouldn't get too deep with people because I just didn't trust. Psilocybin helped me trust that inner voice and feel connected to my body more, to be able to be more pro-social and get deeper with people. And so I really, really appreciate that. And I also appreciate its help for my depressive states that I would be in at times. So it gave me a lot of insight into how it helps with depression. When I was doing my studies for psilocybin, they say that antidepressants are like wearing, a cast on your arm. It allows the emotional brain to heal. But then also with other positive emotions that you experience, you're blunted because there's this hardening on the outside. And what psilocybin does is it allows you to not only develop new insights into why you're depressed or why you're experiencing the things that you do, but it allows you to feel all of it. It doesn't blunt your experience from whether it's good or bad. And it also just helps you process and make sense of it. I think it's important to recognize that, yes, antidepressants can definitely help heal for a period of time or however long your doctor prescribes them for you for. But psilocybin helps you make meaning out of that and expands your consciousness beyond what an antidepressant can do. I went into studying that for 9 months. I got certified, and I have a connection with it where sometimes when I do feel like I need a journey, I intentionally take micro doses, or they say that the best approach and the healing is really when you take the macro dose. And so with someone that I trust, I do a macro dose every quarter, and I receive what I need to receive and then just do the inner work to work through it. There's this culture where people are microdosing. And what I learned in school was that psilocybin affects the 5-HT receptor in the heart. 5-H2A receptor in the heart,
5H2.
The heart valve. So when you are microdosing, it's almost like you're creating this tissue. You're creating this scar tissue in your inner valve. And so it could lead to cardiovascular disease. And there are studies that have proven that. So I just want to say, for people who microdose, please be careful and acknowledge that it could affect your heart in the long run. And so that's why they recommend when you're doing a psilocybin journey to do it in macro doses and seldom. Yeah.
Thank you for that.
Of course.
Thank you for that. So what does your clinical practice look like these days?
So right now, I am strictly working with Ibogaine. So I get clients who come in for mood disorders, PTSD, and I work with them in whatever issues that they want to without the plant medicine. But if they feel called, I introduce them to Ibogaine, and that's when they would go down to Tijuana, Mexico, at New Path, and they do their journey. I help them with their prep work. I sometimes actually go down there and stay with them during their journey. And then afterwards, I do integration work with them. So this is just something that I've created for myself. And aside from my regular private practice as a licensed marriage and family therapist.
Okay. So I'm imagining that a person with a psychotic episode history is a no-go. That's
Right.
a no-go.
A no-go. No. You definitely don't want them to be in states where they can't conceptualize or make sense of their journey. especially if they're not clear in reality in their present moment without any substances in their body. So it could, again, traumatize them more. So we steer away from individuals who are experiencing psychotic episodes or are in manic states.
Yeah. Giving Ibogaine to somebody that has mania or on lithium or something. I'm imagining that also people on psychotropic medications that are, pharmacological interventions, that's a kind of sensitive point. Like, how do you manage that? People that are on meds.
So what happens, we actually have a doctor on staff, and we would have to review their medication history. And then the doctor determines whether they are eligible. So that's another important part. I'm glad that you brought that up, because depending on what medications you're on, you may have to titrate off with obviously assistance from their psychiatrist or their prescriber. And we are in close contact with those individuals if we are given a release from the client or the patient. So that's really important to address.
Interesting. So you collaborate with psychiatrists that are, in the grid of normalcy, I guess,
Yeah. So our doctor at New Path will collaborate with the doctor, and just to make sure that it's effective for them to be able to come and do a treatment. So that's really important. That's a huge safety component to
any other contraindications?
If you are obviously on a long-acting opiate, you definitely want to come off or titrate off to a certain level. And then also if you're addicted to cocaine or any methamphetamines, you definitely don't want to come into treatment while they're in your system. You definitely need to come off, and we do drug tests to see what level you're at before you're able to come and do a treatment, because that could really affect your outcome, and it can be fatal.
Mm-hmm. Sounds like a really life-changing, like this narrative about somebody that was on opioids for 17 years.
Mm-hmm.
I mean, that's incredible.
It's incredible, but I also want to say, when you witness, and if you ever get to see the documentary, you would never think that this person is addicted to anything. I mean, it's not, for me, my thought of someone who was a heroin addict was someone who's like slouched over, eyes hazy and, completely out of it. Person as a functioning human being in society, walking, working, doing what she wanted to, but yet had this strong addiction to heroin. And so I want to also say, like, do not discriminate based on what someone looks like. They could really be suffering with a substance such as heroin. And she was able to go on, get treated. And then now she does advocacy work around the world, helping others who are addicted and unable to get out.
So it's like, it's expensive and it's life-changing. So there's people out there that can't afford this, which is tragic, right? Because, as is the case in so many other situations, that the people that need it the most can't afford it, which is so tragic. There could be a rallying cry for addicts in the family or familiar addicts to get some funding going to get them down to Mexico. Because it's like, what's the ticket cost we're talking about here? For treatment?
For someone who is on who's addicted to fentanyl or other opiates, you're looking at spending $14,000 at a minimum. And so what I want to highlight is that the clinic that I work with, New Path, they actually have a scholarship fund for those who are really struggling with being able to pay and get treatment. So that's really important. Also, the state of Washington is trying to get funding to be able to do clinical research. And this stemmed from the Kentucky initiative that took the lawsuit money from Purdue Pharma to be able to invest in Ibogaine treatment centers in Kentucky. They were rejected. And so it kind of stemmed interest in other states to look into this and try to raise funding to at least get Ibogaine off of Schedule 1 and work on doing research so that we can eventually have this in the US and have it funded by our government officials to help with the epidemic. But for people who can't afford it, there are scholarship funds. One of my mentors he told me a story because I brought this up and I'm like, it's so expensive. How do these people who have lost it all and who are looking at this as a last resort, how can they afford it? And he said, Zahra, I worked a year to be able to afford this treatment. But when I knew I had to work that hard to get this money for this treatment, I knew that I had to make the best out of it. And I knew that I wasn't going back. So sometimes it could be, and that was his story. It's a motivator to see how hard it is to come out of something and to appreciate this plant medicine more. That was one perspective. Hopefully in the future, we continue to get funding from people who really want to help this community and have a larger amount to work with for people who can't afford it.
Awesome. I'm wondering as a last image to share with the audience, if you could share with us using a pseudonym or something, a case where you were really touched, like just bring us into a moment. If you could bring us into a moment of transformation, somebody that you worked with that really touched you.
Her name was Heather. I was sitting next to her bed when she was going through withdrawals. And I will say the withdrawal process is a lot less stressful when you're doing an Ibogaine treatment. You will experience some mild withdrawal symptoms, but it's not as if you were in another setting without the Ibogaine. And I remember she was like, Zahra, I don't know who I am without this drug in my body. I don't know who I am. I've been addicted to meth for 17 years. This is a part of me. And I said, yes, it's a part of you. But look how this one part of you has withheld you from discovering all the other parts of you that exist that are dormant right now. And she looked at me and started crying. And she's like, I can't wait. I cannot wait to see what else there is within me that I have yet to understand and know. And that for me was so touching. There's a documentary actually coming out with this moment. It was caught on camera and her reaction and her cries. It was a really, really touching moment for me to witness that in her and to witness that drive and that eagerness to discover who she is and to live a different life.
Yeah. Beautiful. When's the documentary coming out? What's it called?
I'm not sure yet. I just know that I was there. The producers were there. So it should be coming out like in a year.
All right, Zahra. Well, thank you so much for coming on the show. Is there anything else that you'd like to pitch about your work or about anything,
I want to extend my services to people who feel called to go on this journey. But I also want to say that there is no one size fits all for any therapy, for any therapist out there or any therapeutic relationship or alliance. And so I want to say, if you feel called, reach out to me. If not, still reach out to me and I'll connect you to other people. But it's important for you to, in general, have a connection with the person who is doing the integration work with you. That's really, really important to have, is that connection, that person that sees you and really wants to help you grow and expand. And if you don't feel that within you, then wait until you find that connection.
Awesome.
Yeah.
Thank you so much for coming on the show.
Thank you so much for having me. I was really nervous, but I'm so glad that I did this.
You did great. You did great. It was really fun.
It was a great space for me. Yeah.
Hope to talk again.
Thank you, Brian.
Thank you for listening to the Boundless Body Podcast. Please like us, share, subscribe, and until next time, stabilize, catalyze, and thrive.